I want to talk a little bit about Kybella. Kybella is deoxycholic acid. That's the same thing your gallbladder produces when you eat something fatty. It basically emulsifies fat. We use Kybella, it's an injectable, it's FDA approved for the double chin or preplatysmal fat. It's a permanent fat reduction. Now, there are many variables to Kybella. I get a million DMs every time I post a before and after of Kybella, and people are asking how we're getting such great results with one treatment. This is pretty typical for us, what we see after one single treatment. That's not one vial, that's one treatment. The maximum number of mLs you can do in a single visit is 10 mLs. That's about 4 to 5 vials. And we go for a large amount of Kybella in a single setting. But there's a reason for that. I want to get as much tissue trauma as possible in the single setting because I'm going to get the best skin tightening with that. So I only do one treatment. I wait 12 weeks for these before and afters, and then we check to see how much improvement we have. I have a few patients who their BMI might be greater than 32, or they might have a lot of excess preplatysmal fat that need more than one treatment. I try to predict that ahead of time. But the majority, over 90%, are getting treated one time with multiple vials. Now, in the Kybella study, where they always show us this woman and her improvement, she was actually treated 4 times with 12 mLs. I would not want to come back in every 4 weeks to have my neck injected without seeing any results. And you don't see results by 4 weeks. You don't see them by 8 weeks. It takes a full 3 months, which makes sense. That's how long it takes for collagen to remodel. And we're seeing that effect. That's what causes this nice tightening in the jawline. So at Fresh Faces RX, we do our best to assess how much Kybella you need in one sitting, and we use as much as possible to get you these great results. You will have downtime, and you won't have results for 12 weeks. So your downtime, swelling and bruising. I always say up to a week. It's usually 72 hours that it's the worst, but everybody bruises and everybody has some swelling. Now that's not the bullfrog swelling that you see all these posts about all over the internet. It's usually, it's a fullness. I've had it done. I was back when they used to do multiple trials. It felt like a gel under my chin. It would go like this and it would wiggle. It kind of hurt when I would run or walk. I don't do any of that running anymore. But it was uncomfortable under there. The procedure itself, I'm told, is about a 2 out of 10 in discomfort. We do use some lidocaine with our injections. It's FDA approved to go between the sternocleidomastoids above the hyoid bone. So we've got quite a bit of area that we can treat, and we're assessing how much fat you have throughout that area. I don't like to miss the side over through here. There are some risks with it. Most of these outcomes are temporary though. The one that I've seen is, in that lower branch of the mandibular nerve, if the Kybella gets injected around that, it can demyelinate it. Your myelin sheaths are made of fat, so it makes sense that the Kybella would take that little fatty sheath off. It takes about a month for that to grow back. In the interim, it might shorten your smile on one side. Everyone in the study and everyone that I've treated, that's been a temporary complication that improved, and it's fairly rare. But other than that, we're seeing great results without a lot of the side effects or outcomes other than bruising and swelling, which you can count on. There's one additional thing that we offer with our Kybella. We offer you 2 free radiofrequency contouring treatments. We use our laser. It's called Mini FX. It's from InMode, has the chin application, and you get 2 of those. We do them at weeks 8 and 9, and I think that really helps to clean up any of those residual fat cells. It'll permanently kill them as well. It also tightens the skin. So it's a nice add-on to our Kybella treatments.